You and I were talking about this, and I know that this is a concern for a lot of people. You did talk about the black box warning for Zenrelia. First, let me ask you, how do you stop it? Do you have to taper it, or what's that like?
Yep. Yeah, good question. So, if you're going to go that way, you don't need to taper. That's the one nice thing is you can just cold turkey stop and go from there. And this is kind of a delicate, kind of area here because, some people will be like, all right, what am I going to do? Am I going to put them on drugs that they previously failed and then they're just going to be itching and causing problems? If you follow the black box warning, yes, that's what you would do because that's kind of where you go. Whether you put them on Apoquil, I've even recommended doing little courses of steroids here and there to kind of get them through that time frame. Some people, when it comes to this, they might say if they're highly seasonal, let's shift their vaccines to an off time frame when they're not paritic and shift then to kind of do that. So that's what some people will do as well. I've also seen people go from Zenrelia to twice a day Apoquil to do it. But at the same time, in my experience, that's more immune suppressive and definitely off label than I would experience with Zenrelia. Now, some of the things that are actually happening out there, and there's publications out there for this that they have actually just recently published, and they looked at booster vaccines, because that's realistically our population. They are previously vaccinated. They're not newly, never been vaccinated before if we're using this drug. So they looked at the same type of population, 10-month-old dogs, previously boosted 7 months prior. So again, real world setting. They had dogs receiving placebo, dogs receiving 1 times label dose, and dogs receiving 3 times label dose. And when they actually looked at those dogs, they actually tripled the number of dogs too. Instead of 8 dogs, they had 20 to 24 dogs in each group. On them, there was no difference in titer response amongst any of the groups. They all developed adequate titers and everything there that was similar to the placebo group. And probably even more important, though, for people is that there was no adverse events. There was no serious adverse events, I should say. So there was no deaths. There was no bloody vomiting, diarrhea, stuff like that. So obviously, it sounds like that initial study, there was just an outbreak type situation that was occurring. And that probably is the reason why they had those issues. Based off the current study that's out there with booster vaccines, I'll be honest, I don't recommend discontinuing Zenrelia. I would just continue to vaccinate through it while on the drug, because the other issue is that you found a drug or something that's working for this animal. You don't really want them to be miserable while you're waiting to vaccinate them and stuff. So I have just continued based off of that current evidence-based medicine. There is no reason in my mind to discontinue Zenrelia while vaccinating.
Great, thank you for that.